Hey guys, I am here in St. Louis still offering virtual consultations. Those are going extremely well. If you are interested in a virtual consultation, DM me and we'll get you set up. In the meantime, I want to tell you a little bit about what my signature procedure is. It's called a deep neck lift. And this is something that I think is really special. And I want to talk to you a little bit, since I have time, about what it actually is. And just help educate you a little bit, answer any questions that you have as well. Hey, Connecticut Medical Aesthetics, how you doing? So what is a deep neck lift? So a deep neck lift is when we have a person that, there's kind of two categories. One is someone that is younger and is just born with a full neck. And they're in their normal weight. They're not heavy at all. I think I have a good example of this. Not heavy at all, but they're just born with a fuller neck. So here's a good example. Let me flip this around. So this sweet young lady, very lean, very athletic build, but just born with a fuller neck. A lot of times people think that we can treat this by doing liposuction or Kybella. Someone just asked about Kybella, or something less than a deep neck lift. Well, let's talk about why that's not a good idea. That's not a good idea because different necks are built differently. So in a person that could have liposuction or Kybella or Coolsculpting or some other less invasive procedure, what's happening is that person's neck, they have good, thick, elastic skin, and then fluffy excess fat, and the floor of their neck, their deep neck, is in good shape. So this person, great liposuction candidate, predictably gets rid of this excess fat. Kybella, if it worked predictably, would be a good option, but I found it doesn't work predictably at all. But in either case, if we thin this layer out to match the normal thickness down here, their neck would follow this beautiful new shape and they'd be good. Now, people that are better suited for a deep neck lift are built more like this. Hey, what's up, Jim? GLNZM. How you doing? So this is someone who's better suited for a deep neck lift. So if you look at this, you'll see the fat here is not super excess, but what's happening is the first layer of muscle is sitting diagonally in their neck. And even if you used Kybella or liposuction or Coolsculpting or any other trick to get rid of some of this fat, the neck is going to sit diagonally. What's really happening is the deeper structures are sitting diagonal. There's this thicker, kind of gritty, glandular substance that's built up. And then instead of having a beautiful shape to the muscle here, the deep neck, the floor, it's kind of bowed and sagging, okay? And so this is why liposuction alone or Coolsculpting or Kybella can't treat this and turn it into a beautiful neck contour. So what do we actually do? Here's a good example. What we actually do is we go into that person's front of the neck, we do it through an incision hidden behind the chin, and we actually sculpt and get rid of the excess structures. This is not a Dorito, it's fat. We get rid of the excess structures in that deeper layer, and if the muscle's bowed, we repair that muscle, get rid of the excess sections of it. If the glands are hanging down, obstructing the jawline, we get rid of the excess sections of that. And what that does is create truly dramatic transformations. So we can get truly dramatic transformations like this in young faces. Hey, what's up, Inland Cosmetic Surgery? Truly dramatic transformations without making them look operated or strange. And her only incision is hidden in the crease behind her chin. Interestingly, it's harder to see it now than it was to see when she still had all the fullness. It actually hides better now that we have it fixed. Lucid Dreams, that looks painful, she says. Let's see if we can get a counter to that. How do I make this bigger? This is Molly. Molly's going to tell you if it's painful or not.
Okay, so are you so happy?
Oh my god, I love it so much. It's really nice when I'm able to like FaceTime with my friends and I don't have to worry about holding the phone. It's like my chin doesn't go straight into my neck.
Different clip. I have a clip of her saying that she took literally like no pain pills at all. So surprisingly not painful. Another question I get a lot is, where did the excess skin go? So this is Joni. Joni is our scrub tech extraordinaire. And this is answers where the excess skin goes. Because in this operation, all I'm doing is making the one incision hidden in the crease behind the chin. No skin is removed anywhere. So where does the excess skin go? Well, if you look at this, in the neck shape that we have and don't like, it approximates that line. In the neck shape that we would like to see, it's more like that line. And which of these is longer? Well, obviously the blue line is longer because it takes a longer path than the red line. So when I've sculpted all the deep neck tissues appropriately, the excess skin is actually not excess. We need all of that skin to follow that beautiful new path and get the right shape. So we can do this in people with good skin texture, good skin body. So Joni's just about 40 when I did this for her. We can do this with no incisions around the ears at all. So she can wear her hair any way that she wants to. There's no incision literally at all to be seen. And we can even do that with necks you would think we could no way do that to. So this one you would think surely there's excess skin here, right? No excess skin, no skin removed. The only incision is in the crease behind her chin. This is the natural crease. I hid an incision in there, did her deep neck through it, and no skin was removed, no incisions around the ears. Sorry, that was my cat's tail. This is Rocky. How you doing, Rocky? So, yeah, so that's the deep neck lift. Here I have a series of people. We do this on men as well. As a matter of fact, men are some of our best candidates. So another guy, lean, good shape, wanted to see a little bit of a more angular, kind of more masculine, almost more dangerous kind of profile. And he really got it. He got exactly what he was after. He went from kind of a little softer looking to a little sharper looking, a little more sculpted look. In this person, I also did a chin implant. And it's nice because we can place the chin implant through that exact same crease incision that we used to do the deep neck lift with. And we can really make him look angular. This is a picture that he sent us. I like this one. I say we took him from bank teller to bank robber when we did this procedure on him. Well, thank you so much. We have a couple testimonials coming in on the text chain. So this is a great procedure for men as well. As a matter of fact, this is a very good friend of mine. He's a resident that trained with us. And towards the end of his training, we did his nose and his neck. And really transformed his appearance. He's always been a sharp-looking guy, but now it turns it into just a really well-balanced profile. So that's the deep neck lift. And that, I hope, to help explain the difference. This is maybe the most dramatic example. Sorry, this picture's a little graphic. But this is all the stuff that we took out to change from one shape to the other. So if you look at this gentleman here, I did remove skin on him in the end. He had so much skin. He also got a chin implant as a part of his operation. But all the sculpting, excess muscle tissue, overgrown glands, deep fat fibrous tissue, more excess muscle tissue, overgrown glands, all of that is what created the sculpture that changed his build entirely. So this is a soccer player. And so someone says, my results are great. Thank you. Am I using a specific term for this operation? Yeah. So I call this a deep neck lift. And actually many surgeons around the country do something very similar. I learned this from Tim Martin, who's a really great surgeon in San Francisco. But it's not easy. This is not something, I would say maybe 5% of active face and neck lift surgeons do procedures like this. So these are both long-term post-ops. There's Joni again. And then here's our new friend. I can't say his name. He'll tell you if you run into him. Obviously, I'll have permission to show all these pictures. But yeah, it really makes a dramatic difference. And we can do it in a way that's just very natural and very, very pretty. Through that same operation, we can also change whether a face looks bottom heavy or not. So this is not a facelift. This was that deep neck lift, getting rid of the fullness in the bottom part of the face. And then we did some fat transfer up into the top part of the face to re-expand the middle of the face, and it changes her overall balance. So, question, is Lipotite similar with less downtime? That's a great question. So Lipotite is different. It's my favorite procedure right now, I would say. I think it's the hottest procedure right now. Lipotite can do well, not as well as deep neck, but pretty well with something like this. It can do way better than liposuction can. So Lipotite is a procedure. You can look at my profile. You'll see that and I'll do a live on this tomorrow. We remove just the right amount of fat from here and then use internal suturing to tighten this muscle, and then use radiofrequency to tighten the overlying skin. And so we can get, I'd say, about half of the result of a deep neck lift in most people's cases. And Lipotite has almost no recovery. I mean, it's a drive yourself home kind of procedure, and people look good within a couple days. Actually, let me show you I'll do a sneak peek of tomorrow's. This is a 1-day Lipotite result. So this is a different procedure. This is not good enough for someone that's got real neck issues, but it's good for someone like this. And this person is exactly 24 hours after her procedure. Yeah, so face tight is the RF portion of it. And then we also add liposuction. And then we also do internal, basically a Giampapa suture. So that's the medical term for those. But we'll go over this in more detail tomorrow on the live. Recovery time for the deep neck lift, which is what we really started talking about. Recovery time for the deep neck lift is on the order of 10 days, I would say. It's definitely worth, it's definitely worth the time though, because this kind of result is permanent. I'm going to flip the camera back around here. There's Rocky, just hanging out, chilling. So the thing about these permanent surgical results, which is great, is that, home right now during lockdown, they're not, it's like watching Botox go away, watching your fillers go away. These guys look as good now as they ever have. It's a permanent result. Let's see. Have you looked at Elevate? Yeah, I think Elevate's actually great. This is another doctor asking. I think it's a great way to do a Giampapa suture. It's kind of like Giampapa suture for dummies. It's a phenomenal device, and the guy that invented it, Greg Miller, is really smart. So I think it's a great procedure to learn if you're looking to learn something. Is Lipotite the better option in the young patient? Yeah, usually. It depends. So for instance, this young patient would not have gotten this result with Lipotite, unfortunately. So the best way to tell you if it's a good option or not is, shoot me a DM and I can help you figure out which way is probably the best answer. Really, the best way to do it is to feel. And when I feel your neck, I can really tell. Can it be done under local? Lipotite can be done under local. The deep neck lift, I really need to have you more relaxed than local anesthesia alone. Let's see. Question: I was told I needed genioplasty for the inferior border of the mandible. Is that much different from this? Yeah, totally different. Genioplasty reshapes the jaw bone. This is all working on the soft tissue. I could use a deep neck lift myself. So I need to get one of you guys trained. Let's see, other questions that we have here. Nothing but great things and comments. Thank you so much. King of Jawlines, thank you. Another question I had, are we using a specific technique for my procedures? Yeah, you go to qmp.com. I actually have a whole series of videos that I've done with qmp.com, and it's teaching for surgeons, teaching how to do that. This is actually a good illustration from that series. In a good young neck shape, we want to see nothing hanging below the jawline. And in most aging necks or genetically full necks, it's not just fat, it's this stuff, muscle and gland that's sitting below. So if you suction away all the fat on the surface, it doesn't really change anything. So what we're really doing is carving, sculpting all the excess tissues to get them to sit at exactly the right level and make it look like you were born that way, which really makes it look very natural. Let's see. I have more chains than a Chinese phone book. You need to get a job at a nightclub. That's a good joke, Joe. Let's see, what else do we have? A bunch of other questions. Feel free to ask me anything you want. And if you want to shoot me a DM with questions and not be on the chain, you're welcome to as well. Who else? Just amazing. Thank you so much. The Monroe Everly. Is general anesthesia required? No, actually. So we do this under sedation. So the person is so sleepy, they don't feel anything, they don't remember anything, but they are not under general. There's no breathing tube. They're breathing for themselves. As a matter of fact, if I were to do these under general, it would be harder for me because the breathing tube would be in my way. It's actually easier for me to do it under good sedation. And that's really an art. To do sedation that well is an art. We actually have our own anesthesia providers. I don't just go to some random place. The anesthesia provider is an integral part of doing this right. Let's see, other question. Best kind of Botox. Oh, Annalisa Page. Hey, Annalisa, we need to do our live together. Maybe we'll do that later on tonight or tomorrow. Best kind of Botox and fillers. It really depends on what your target is and what you look like. And again, if you want to shoot me a DM, we can get you set up with some information. If you have done a lot of Kybella, is it still possible to do the neck lift? Absolutely. So I have done many neck lifts in failed Kybella patients. And when you really think about, all the times people do Kybella, it's an awful lot of bruising, swelling, downtime. When you add all that up after 3 or 4 or 5 sessions, you would have had less downtime with the neck lift, interestingly. Is there risk of rejection for a chin implant? Not really rejection, but infection, yeah. So about 1% of chin implants could become infected. If the chin implant were to become infected, it would need to be treated with antibiotics. That usually works. If the antibiotic does not clear up the infection, then we have to, excuse me, seasonal allergies. We have to take it out, replace it, and then put in a fresh implant. So yeah, it's not a rejection so much as infection, just like with the knee implant or the heart implant or something like that. All right, let's take another look at another couple other pictures here. I just love this operation. We're gonna flip around again. So I just think oops, my desktop just went away. For what the procedure is, I think it's just phenomenal. The way it changes people it's permanent. The deep neck lift is sculpting tissues, and there we go. There's another example. What is sculpted is sculpted. It's not going to come back. It's been taken out and thrown away. So makes truly long-term, truly elegant results. This young lady was so sweet. She cried when we were talking about it afterwards. It really changes people's lives. And a lot of these that I'm showing you are younger patients, and the reason I think it makes a bigger difference in younger people. I think it really makes all the difference, and then they get to enjoy it, into their 30s, 40s, 50s, 60s, their whole life. So I think that's a good one. Flip back around here. Thoughts on vaser for lipo? I don't use vaser. Vaser is an ultrasonic liposuction system. I think it's great when you have a large area of fat to treat. When I'm using liposuction in the face, I'm taking out tablespoons. So it's not worth it for me to invest in that technology. It wouldn't change anything. It's when you have cups or quarts of fat that you're removing, vaser becomes worthwhile. What do I think of stomach liposuction? It's amazing. I've done it. I hate it. It's just, from the surgeon standpoint, it is just, I get to do the fun stuff, the true artistic stuff. Stomach liposuction, do that all day long, it'll wear you out. So I am a face guy, but the procedure itself is fantastic. Are you able to share what the future holds from the Med Spa Mastery course with Esther Chu? That's a great question. I'm not sure if you're in on that discussion. So what's funny is Esther's a great friend of mine from college. She actually just did a TED Talk yesterday. So if you go to TED, TED, and look at the big TED Talk from yesterday, it was Esther. And so she went over a lot of that exact same information in her TED Talk. And I was like, yeah, we got her first at Med Spa Mastery before TED got to her. So let's see. All right. Well, thank you all for watching. Again, that procedure, I'm going to show it to you, a couple more examples. That procedure is the deep neck lift. The deep neck lift is the only thing that creates results like this. And if you are interested in learning more, and again, none of these patients have incisions around their ears. The only incision they have is hidden in the crease under their chin. So if you're interested in learning more about results like those and procedures like that, please let me know. All right, be safe out there. Like I said, feel free to DM, and we'd be happy to set you up with a virtual consultation. Have a good day.